Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, you can find health help on your small screen. Just watch. Then, a top chef ignites taste buds with fare from the hottest recipes in the firefighter's favorite cookbook. You know the motto, be prepared. But even for a trip to the emergency department, it's the truth. Scout's honor. Plus, meet a medical guardian ready to guide you through the maze of caring for a parent with dementia. And how same-sex couples should file their tax returns for maximum benefit.
So it's time to get going. Pull up a chair and join us at our kitchen table for Golden Opportunities. Admit it, thanks to YouTube, you've watched everything from cute cat videos to wannabe singers, and of course, Golden Opportunity segments. But have you ever thought about watching slice of life videos to improve your health? Lisa Nelson is here to help us channel important information that you can have playing on a small screen near you. Lisa is the supervisor for marketing communication at Medical Mutual of Ohio. Welcome to the show.
Thank you for having me.
So we can have free health help while we're watching our laptop?
Sure. On your laptop, your tablet, smartphone, whatever you get internet access on, you're able to watch our suite of videos, whether through our website or our YouTube channel, which is youtube.com/MedMutual.
Okay, so what kind of topics can we expect to find?
We've got a variety of topics covering our programs and services, basics of health insurance, as well as some testimonials from our members.
Ooh, okay, that's even better sometimes. So can you give us a few specific examples?
Sure. We have a testimonial from one of our members who participated in our Quitline program and used the program to finally kick the habit after many years of smoking.
That's always a good thing. Tobacco's bad news for you. Anything else?
We had another story from a teenager who had diabetes, and her family used one of our programs to help them successfully manage her diabetes, and they got the benefit of having diabetes testing supplies delivered right to their door at no additional cost.
Ooh, very handy, very handy. Is there a way I can work out while watching?
Sure. We actually have a video featuring our fitness discounts program, which offers our members an opportunity to get fitness club discounts at various locations around the country. And it's something that they might not have seen when they were reading their plan details, so it's really a good thing and to remind them of what's available to them.
Do people really read their plan details? They should,
right?
They should. Because they're missing out on these things.
That's right.
Anything else like actually on the YouTube channel?
Sure. We have exercise videos, and it'll walk you through basics of using medicine ball, exercise bands, and stretching techniques.
Oh, sounds interesting. You don't even have to leave your house.
No.
You just get out your little tablet and get moving.
That's
there.
Right.
So what about if we want to learn more about just insurance in general, like definitions? I mean, the terms can get to be very confusing.
Yes, health insurance terms are really confusing for people, so we want to make sure that they know the key terms that are really important for managing their health care. Terms like coinsurance and copays and premiums and deductibles. We also have a video to help our members walk through and understand and read their EOB forms, which are explanation of benefit forms, something you'll receive after you have a service.
Oh yeah, I have clients who just cannot understand those. It gets very confusing.
Yes.
So, anything else?
We have videos that talk about healthcare options, whether you're a single parent, an empty nester, have a family, in between jobs, what you want to look for in a health plan.
Okay, but they shouldn't replace real, just like they say, see your doctor for real medical advice, right?
Absolutely. These are great, helpful videos, but they can always call our customer care line or visit our website for more information.
Do the videos send them there also?
Yes.
I hope so.
Yes.
People won't know what to do. This is fantastic information, especially for people who can't necessarily get out and get going, and they can get that information right at home.
Yeah,
so.
People learn in different ways, and this is just another avenue for people to get a little bit more information about their health plan and get the most out of their benefits.
It's great information, so thank you. So with these videos, you can learn to be healthier and have a healthier understanding of your health insurance anytime you want from any device that you want. My thanks to Lisa for tuning us into these must-see segments.
Find out more about Medical Mutual of Ohio by visiting their website, www.medmutual.com. Next, get fired up with great recipes. But first, the cold and snow of winter can weigh heavily on our spirits and our scales. While 2 to 4 pounds is the average person's gain during old man winter's reign, bears hiding in hibernation don't pack on the pounds. In fact, they lose a large percentage of their weight during their long winter's nap. Can you tally the total? We'll add up what they subtract when we return.
My husband and I got into the car and we couldn't do it. We couldn't pick one baby over the other. Coming to Metro changed the entire pregnancy. We actually started to become happy with our situation. We owe a big thank you to Metro. I can't imagine our family without Sam.
While we may gain weight during winter, a bear can boast of losing up to 25% body weight while sleeping away the season. Don't worry, by fall, they'll be filled out. And hopefully, we'll have slimmed down.
When certified financial planner Jim Lineweaver from the Lineweaver Financial Group is here, we generally talk about investing, but today we're going to talk about ingesting. He's brought along well-known chef Brant Evans, owner of Pura Vida and Blue Canyon, to create a delicious dish, and Mike Mochan, firefighter from the city of Brooklyn. And they'll all dish about how investing in the purchase of a cookbook will reap great benefits, great dividends for children. So we're going to talk about the cookbook in a minute. But Brant, so what are we going to be making here today?
Well, this will be one of the recipes that are in the cookbook. It's a Asian salmon with lime, jasmine, rice, and spinach.
Sounds fantastic.
Wonderful.
Okay, you get cooking.
Okay.
So we can
All
eat.
right.
And Jim, while Brant's cooking that up, I understand why a chef might be involved in a cookbook, but how did you guys get involved?
Yeah, this is first for Lineweaver Financial Group, but what we try to do every year is really help a great charity in the greater Cleveland area and try to give back to the community that's helped us throughout the years. And once we learned about aluminum cans for burned children, we just thought it was a great cause to try to help out and provide some money for the kids.
Okay, well, we can still relate this to investing. It's investing in the community. So how did the whole project come about?
Well, we handle a lot of municipality retirement plans, and it just so happened to be that we were actually walking in one of the fire departments, and it happened to be lunchtime, and we just had this fabulous aroma of great food, and when they're cooking for 10 or 15 or 20 people at a time, we just came up with the idea that, wow, it's a charity that a lot of firefighters support, and they do phenomenal cooking, usually every day in their firehouses. So could we put the two together and try to raise some great money for a good cause?
Sounds like a perfect idea. So I know, Brant, you're not a firefighter, but you know a lot about fire when you're talking about cooking
Exactly.
here. So why did you decide to get involved, and even so far as including some of your own special recipes?
Well, when Jim and his company approached me and said, hey, we're doing this wonderful project for ACBC, and I didn't even have to think twice. I mean, it was something so easy. I have all these recipes from years back already created, and I was really excited to share. So.
Okay. Oh, is that a picture of it there that we're showing?
That's going to be the front cover.
Look like? Excellent, excellent. And so, Mike, I got a question for you. Jim mentioned proceeds go to aluminum cans for burned children, which is a great charity. So tell us more about it.
Aluminum cans for burned children was started back in 1984 by a bunch of firefighters, and what we do is we recycle aluminum cans from the fire stations, and then we use those proceeds to send kids to the burn camp. We have a summer and a winter burn camp. We also use that proceeds for the fire education, for the fire safety trailers that come out to all the school, the fourth graders every year. They come out there, and it's just a great program. And then we have also kind of a little, after the kids get older out of burn camp, we have programs that they can go into to help them get on the right path in life.
Okay, so aluminum cans, can people help out too?
Absolutely. Again, you can drop your cans off at any fire station, usually around back. They'll collect the cans, and that helps out great for us.
All right, so Jim, we want to get this cookbook because this smells fantastic. So we definitely want to get this cookbook.
Yeah.
So how do we order the cookbook, and and
Get some of these great recipes.
Yeah.
What ends up happening is you can actually stop at any of the local fire departments and put in a pre-order, or if you didn't want to do that, you can just log right onto lineweaver.net.
Oh, we got that up on the screen
Yeah,
for
and you'll
people,
see a
so.
pre-order entry there. And by the way, 100% of the proceeds are going to the charity. Lineweaver Financial Group is absorbing all the costs of the book. So your full purchase will go to benefit the kids.
And how much you say it was?
$10 a book.
$10 a book. Wow, sounds great for that. So, okay, we've got a lot of questions answered. When do we eat now?
I know. So what I did was,
Get in.
I threw some soy, some maple syrup together, got that going to a boil. I made what's called a slurry. That's cornstarch with a little water, and that's typically when you see like Asian sauces. They're thick, but they're more glazy than thick. Well, that's because they thicken it with an arrowroot or cornstarch. So then what happens is after you bring that to a boil, get this wonderful, beautiful maple soy glaze. That I threw a little red pepper flake and some lemon zest into it.
And we've got the finished product.
And what I like to do, I like to actually shred the salmon on this. So, you know, it's a different presentation and wonderful flavor with the jasmine rice.
It smells fantastic. So for this fabulous recipe from Chef Brant Evans, and with many more, for many other delicious recipes from firefighters around the area, order your book today. It's the Firefighter's Favorite Cookbook, presented by the Lineweaver Financial Group. You'll get tried and true recipes, and you'll also be serving up some really important help for burned victims. And thanks to Jim and Mike and Brand for making this cookbook a reality.
Thank you very much.
Thank you.
For more information, call the Lineweaver Financial Group at 1-888-313-4009 or visit www.lineweaver.net. Next, emergency preparedness. Looking for places to go, things to do? Welcome to our community calendar. Stick this on your calendar: the Geauga County Maple Festival. From April 24th through the 27th, celebrate maple syrup and more. Enjoy arts and crafts, bathtub races, parades, pancakes, and other entertainment. To pour over more information, call 440-286-3007 or visit www.maplefestival.com.
A medical emergency usually arrives as a surprise. So how can you prepare for what you don't know is coming? Don't you just have to get up and get to the emergency room? Well, let's ask the advice of a physician who was named one of Cleveland Magazine's top doctors, Dr. Craig Bates. Dr. Bates is an emergency medicine physician at Metro Health, as well as the medical director for Metro Life Flight. So what better person to ask about emergency rooms? But, I mean, how do we prepare for health emergency? Isn't the most important thing just get yourself to the hospital?
Well, getting to the hospital quickly and safely is always a concern, but I think it's also important to have a bigger plan, especially with older adults. You may have more health challenges. It's a little more complicated when you go to the hospital, so making sure you have the right information together and you have the right resources in terms of the people that are going to help you or can maybe even speak for you if you're not able to give that information. That's very important.
Okay, just like you prepare for a tornado or, you know,
Right.
storms or whatever else,
Right.
you got to be ready to go. So I understand you kind of put together a list of things that we should be doing. What's the first thing most important?
I think having a list of folks who can speak for you if you need it, if they're not with you, contact information for them so they can be reached, to give additional information or background on you. Because even if you were familiar with our medical record system, new things could have happened. It's always better to have someone in person to kind of verify information and make sure it's correct so we can take the best care of you.
Okay, and they should know what's going on. And to know what's going on, I mean, I suppose one of the things to do is to have your plan and let them know if something's going to happen, where do they fit into this whole thing?
Exactly, yes. So I think, you want to make sure you assume, because depending on what's wrong with you, I mean, we saw over 100,000 people last year, everything from a splinter to major trauma or, heart attacks or strokes. Some things take longer than others when you go in. So I think being prepared, having having something to read or like a tablet to read on or whatever, making sure that bring a change of clothes in a bag just in case because you need to be admitted. I'm sure someone could go home and get it, but it's just a lot. If you have less things to worry about for your visit, you're going to be more focused on what matters, which is helping figure out what's going on with you and helping you get better.
Yeah, like have a go bag just in case anything happens.
Exactly.
So what's next? I think you talked about health history with me before, right?
Yes.
So Because the doctors don't have time probably to ask a bunch of questions or can't.
Well, even if they do, it's good to have have some stuff in writing. I mean, when people come in and they're prepared, they have a family member who can help them, and they have a list of their medications and their health history. It's incredibly helpful because today's electronic medical records are very fast. We can look things up, but if someone's there to give you information you know is verified, there's no chance it could be out of date, and we get that information in real time while we're talking to you. That's very helpful. And it can make all the difference. If you have a minor problem, of course it doesn't matter. But if you come in with, say, stroke-like symptoms, seconds really matter. And so the medical team, and it may feel like the Spanish Inquisition sometimes, they're asking you all these questions. They want to know, how long the symptoms gone on. They want to know what medications you're on, because things about your health history may dramatically alter the path you take and what care we can provide you. And that stuff is very important. And imagine if you have a circumstance where an older adult can't speak because they're having a stroke, for instance, and they lose their ability to speak, at least temporarily. And it can be very tense trying to figure things out. And it's always helpful to have someone who can kind of speak for the patient, knows them pretty well. And also, I think it's important to think about who can make decisions for you. I mean, there's legal ways to do that with healthcare power of attorney and such like that. And this has to be figured out in advance. This isn't something you want to figure out in the middle of a crisis.
Oh, no. I mean, and you need to talk it over with that advocate that's going to be with you, because they need to know all these things where you have them, even if they have to grab them on the way. So
that's right.
Excellent advice, I think, for our viewers. So don't wait for an emergency. Expect the unexpected and prepare for it right now before it happens. Follow Dr. Bates' prescription and create a health emergency plan, and then share it with your family. This ounce of prevention could be worth more than a pound of cure. My thanks to Dr. Bates for joining us here today.
Learn more by calling Metro Health at 216-778-7800 or click to www.metrohealth.org. Next, guarding against inadequate care. It's time to get up and go, an exercise minute on golden opportunities.
Hello everybody, I'm Mike Carbon from Breakout Fitness, and today we are going to utilize our exercise ball to do a push-up. This is a great exercise that will help us work those chest and tricep muscles. They're so very important in pushing objects away from us. All right, all we're going to want to do is we'll start by laying on the ball. Now we're simply going to rock out a little bit so the ball's at about our waist to our waist height. We're going to move our body as one unit as we lower ourselves to the ground and exhale to push yourself up, okay? Remember to take deep breaths, breathe in on the way down, and exhale to push yourself back up. You can make this exercise a little more challenging for yourself by simply moving out a little further as your fitness level progresses. How you feeling?
I'm still on the ball.
Excellent. All right, everybody, 12 to 15 repetitions to get started, and now it's your turn to get up and go.
For your copy of the exercise booklet, please send $1 for postage to Golden Opportunities, 23240 Chagrin Boulevard, Suite 450, Beechwood, Ohio, 44122.
Mom needs help paying bills, but you live out of town. Or Dad needs assistance with day-to-day tasks, but you work full-time. Or maybe you're just not even sure what care or help they may need. There are answers to all of these issues, and Molly Nieder is here to explain. Molly is the co-founder and owner of MedGuardians. Welcome to the show.
Thanks, Lori.
This all sounds like a puzzle to me. I've been through it. Lots of my clients have been through it. What pieces do we have to know about to make sure everything does fit together?
Well, most of the time, families are really good about planning for finances, planning for legal, and they get all that in order. But the piece that's missing is actually the medical piece. And that's where our services come in, because we're able to be the objective eye and come in and really assist families with figuring out the process of helping their loved one.
Okay, kind of like the emergency plan we were just talking about.
Yes.
So how do you do that?
Well, we do that first with a needs assessment. And what we're really looking at is, what does this person actually need to live their life every day? We're looking at their medical pieces, their diagnoses, their medications, and also just what happens within the home. What we're really trying to do is work on a plan for them and figure out how this works. Now, of course, there's always caregivers, and it may be a family member, maybe a neighbor, and so we're looking at that too, and is this caregiver actually giving care that they want to give? Is it too stressful for them? How can we relieve that stress and allow them to have a relationship like they want to have with their family member?
It's always very difficult. So you're meeting and talking to the family, the caregivers, this person that you're trying to plan for. You've gathered all this information together. What's next?
Well, what we do is we take the information and we put together resources. And these aren't always just resources that have to do with outside facilities. It could mean that somebody has some informal resources like family members, someone who could come in and actually mow the lawn for them, do things like that that will take some stress off the caregivers and also allow that person to stay in their home. And that's what we ideally would like to see.
Okay, so we've got the plan, we've decided what to do, and we're good to go, right?
Well, yes, most of the time. I mean, it goes for a certain period of time, but we all understand that sometimes people get better, and we can take some of those resources away, but most of the time people seem to get worse. And what we're doing in this situation is we're interacting with the family and allowing them during our oversight to figure out what's going on with this person. If they're deteriorating, how can we then change our care plan to meet those needs of the person that they have now?
Because things change, so you always have to kind of change the
Yes.
path. Okay, so I mean, any kind of these plans, I'm sure that some of the options might be costly. So how do you factor in to that plan of care the cost and what the family can afford and what they want to do?
Right. Well, we're really sensitive about being efficient with monies. The nice piece of this is we don't provide services ourselves. So we're able to look at the resources, find the ones that fit exactly to that person's needs, and then we offer that plan up. It doesn't mean we're saying you have to provide this plan. We're saying that that plan is available. It's an option for you. And then we find those in a variety of price ranges, as well as within our database of facilities that are close by or services that are close by.
So lots of options and lots of ways to help the problem.
Right.
So this is great. And we all want the best for our aging parents, but it's not always easy to figure out just exactly what that is. A service like MedGuardians can help. To find out more, use the information that's coming up next. My thanks to Molly Nieder for joining us here today. Thank you.
To learn more, call MedGuardians at 800-229-7149 or log on to www.medguardians.com. Next, how same-sex couples should file their tax returns.
Hilltop Village Apartments is retirement living at its best. Residents enjoy a wide variety of activities and living services with all large first-floor apartments. Private screened-in patios with beautiful park views, daily dining room meals, free laundry facilities, 24-hour staff, and so much more. Enjoy safe, comfortable independence at a very affordable price. Call today for a tour and learn how you can get your first month's rent free. Hilltop Village Apartments, retirement living at its best.
Did you miss a phone number or website? Then here's your second chance, because we're going to list all of that information again. Then we'll be back with a tax tip for same-sex couples. For same-sex couples, we have some very important new tax information. If you're watching this program and you have children or grandchildren who have married someone of the same gender, make sure you let them know the information we're about to give you. Here to explain is my law partner, Mike Solomon.
Hello, Ray.
Hi, Mike. So what's the big news here for same-sex couples?
Well, even if you've already filed your tax return for 2013, this is still important. Same-sex married couples, the IRS now allows to file joint married income tax returns, which for some couples can save them thousands of dollars of income tax.
And that's always a good thing.
Yes.
But I know same-sex marriages are not yet recognized in Ohio.
That's right. Now, Ohio doesn't recognize same-sex marriages, but if you are legally married, same-sex marriage in another state, and you live in Ohio, you can file a federal income tax return still as a married couple. You can't do that for Ohio, and that's where it gets a little complicated because Ohio's tax return is based on the federal tax return. So it gets more complicated because Ohio at this point doesn't recognize same-sex marriages.
Okay, so how does a same-sex couple file tax returns for Ohio?
Well, what they have to do is they have to file as an individual or as a head of a household. And what they do is on the first page of the Ohio return, there's a box you check, it's ITS. And you check that, and there's a separate form you fill out for Ohio. And what it does is it changes your joint federal income tax return as if you filed singly, as a single person, and recalculates your tax so that you can calculate your Ohio income tax.
Okay, so you can just kind of pull out of the federal just
That's
what there
right.
is for Ohio. Okay, since our tax returns were filed already in most cases for 2013, is there anything we can do to help cut the taxes for last year?
They can still go ahead and, if they've already filed their federal return, just go ahead and amend it. There's a form to amend a federal tax return, amend it, and file it as a joint couple at that point.
Okay, doesn't sound all that complicated.
No.
But if people need more information, where can they go?
There are two websites you can go. I don't know if they're going to show it on the screen. Yes, they are. Ohio tax returns are at www.tax.ohio.gov, and the federal returns are at www.irs.gov, and you should be able to get all the information you need there.
All right. It was great tips here today again. If you or family members are a legally married same-sex couple, then you'll want to make sure you understand how the tax filing rules can benefit you, even though Ohio still refuses to recognize gay marriages. Even if it's legal in another state, Ohio isn't doing that yet, but the federal is allowing it. So the tax filing rules, though, because of that, are a lot more complex. If you have any questions at all, please give Mike a call.
Call Budish, Solomon, Steiner, and Peck at 1-888-236-5173 for more information or to schedule a speaker for your organization. We also offer free CEUs and CCMs for nurses, social workers, and case managers. Or log on to www.bssplaw.com.
Thanks for joining us. On next week's show, we'll prescribe the latest medical news to enhance your health. As we look ahead to summer, please, we'll look back at some warm memories of this season in Cleveland. We'll make Mom's Day with the perfect way to make her smile. And we'll construct a craft that will capture your creativity. But until then, please remember to make the most of your golden opportunities.
Would you like to join our kitchen conversation? All you have to do is call toll-free 1-877-765-1543 and leave us your question, name, and phone number. Or log on to www.golden.tv for all the latest information and show updates.